Good evening, you're watching No Spin. I'm Nidhi Razdan. I know you don't want to hear this, but COVID has not gone away. If anything, it's actually making a comeback, at least in Delhi, Gurgaon and Mumbai. And more cities and states could follow soon. India's cases overall have been at record lows for weeks now, and thank goodness for that. But over the last few days, there has been a sharp surge in these cities. In fact, today, just now, we've got the numbers for Delhi. Delhi has recorded its highest number of cases today in 40 days. Now, a couple of things have happened recently. Schools have reopened, so kids are back in class. Mask mandates are gone everywhere. So now you have some schools in the NCR region, that's the National Capital Region, that have already been shut down again because of COVID cases amongst children. Now, that's making parents worry for various reasons. Now, the question is it schools reopening that is driving cases up? Hospitalizations, thankfully and very importantly, are still quite low. So the question we have to ask experts is, do we need to worry? Have we let our guard down too soon? What is it that we can do to prevent this from escalating? And what should schools do if some children do test positive as they are at the moment? How can we find a way to live safely with COVID? Now, just take a look at these numbers from Delhi and Mumbai. COVID cases in Delhi up 37% in the span of a week. And I told you, we've just got these latest figures from Delhi today, the highest number of cases in 40 days. It's only 325, but it's an upward trend. Mumbai up 17% in the span of a week. Gurgaon, by the way, which is a suburb of Delhi, cases are up 100% in the last week.
Crowds without social distancing and no masks, as now cases have started rising in Mumbai and Delhi. The national capital on Wednesday witnessed a jump of over 48% in daily cases compared to Tuesday. Positivity rate increases to 2.79% from 1.12% a week back. Active cases rise to 515 from 367 in a week. Daily COVID cases rise by 137% in a week. The Delhi government says no need to panic yet.
Hospitalizations नहीं बढ़ रहे और अभी चिंता करने की किसी जरूरत नहीं.
As COVID cases are now being reported in the schools as well, the Delhi government has come up with fresh guidelines for the safety of students. The first guideline includes that if a COVID case is reported in a school, then that wing or the entire school may be shut down for a brief period of time. Second guideline mandates the students and the teachers to wear masks and maintain social distancing. And the third one is about proper hand hygiene and awareness drive among students and teachers as far as the COVID appropriate behavior is concerned.
पेरेंट्स के मन में कंसर्न और इतना बड़ा ये जो पैंडेमिक आया था, सभी लोग डरे हुए हैं और अगर दोबारा से इस तरह के केसेस आते हैं तो हम चाहते हैं गवर्नमेंट पहले से ही कुछ स्ट्रिक्ट एक्शन ले ले.
मैं लगातार नज़र रखे हुए हूँ, किसी भी स्कूल में कहीं एक भी केस आता है किसी टीचर या किसी एक बच्चे को, तो उस वक्त स्कूल भी हमको रिपोर्ट कर रहा है और हम भी स्कूल को जो भी दिशा निर्देश हैं इंडिविजुअली दे रहे हैं.
In neighboring Gurugram, where cases have gone up 100% in a week, officials are suggesting a return to masks.
And in the district task force meeting, it was decided that we propose government again for COVID appropriate behavior or maybe compulsion of mask. So we are planning to cover all 60 plus people by Har Ghar Dastak.
In Mumbai, a noticeable spike in daily COVID-19 cases, with the city reporting 73 new COVID cases on Wednesday. Between 31st March and 6th April, the city reported 283 cases. And between 7th April to 13th April, the city reported 331 cases, a 17% jump in a week.
Mumbai's civic body, the BMC, says that the latest spike in the number of COVID cases is not a cause for panic, and such patterns are expected in the life cycle of a pandemic. However, it warns citizens to continue wearing masks and practicing social distancing.
XC वेरिएंट को लेके पूरी दुनिया में जो है बहुत चिंता फैली हुई है. महाराष्ट्र में भी स्वाभाविक है कि इसके ऊपर सतर्कता बनी है.
While cases are rising in some cities, the overall COVID count remains stable, with about an average 1,000 cases being reported across the country in past 1 week.
There is a very small uptick if you look at the total number of cases in number of cases of COVID-19 in different parts of the country. But I think it is not at all a problem at the moment, since the intensive care admissions and total number of deaths and also the test positivity, these rates are not very high.
An NDTV Bureau Report.
Well, authorities in Delhi have called for an urgent meeting due to the rise in the number of cases in the national capital. Joining us, a terrific panel tonight of experts, also teachers, parents, kids, everyone who's affected by another surge in COVID cases. Thank you to you all for joining us. Let me go across first to Professor Srinath Reddy, the President of the Public Health Foundation of India. Sir, do we need to worry?
Well, I don't think we need to worry, but we do need to be cautious. I think it has been a misconception that the virus has gone away and is not going to be re-entering India or our homes anytime soon. While the virus is still in active circulation in many parts of the world, we also recognize that we are still at some threat. And particularly with some of the new recombinant viruses coming in, we must be cautious. Much of the Indian population is protected by acquired immunity, whether from vaccines or natural infection. But some of that immunity would be fading off in some people. But while most people have been protected against severe illness and death, when the virus does enter the body, it can still infect you and cause mild illness or remain asymptomatic. So infections rising is not a surprise when people have discarded masks and all other precautions related to crowding. And I think that was absolutely not correct. I had written earlier that at least till end of April, we must maintain some caution while we resume our normal lives. And just to draw a cricketing analogy, when a pace bowler is replaced by a spinner, you can take off your helmet, but you don't cast off your gloves and pads. Not till the match is over, and the match is not yet over.
Clearly, and that's a terrific analogy. Let me go to Dr. Shashank Joshi, who's a member of Maharashtra's COVID task force. Dr. Joshi, would you agree that the mask mandates were lifted too soon? Do you think it's time to bring masks back? I mean, authorities in Gurgaon near Delhi are saying do it. Bring them back.
So I think I agree with Professor Reddy. Indoor masking in closed, poorly ventilated environments are desirable. COVID-appropriate behavior is still needed. Very clearly, I agree with Professor Reddy that we have a good amount of natural and acquired immunity both, particularly with the large exposure we have had. So there is no need to panic at all. At the same time, we need to be vigilant on surveillance, both sentinel surveillance and genomic surveillance. We need to protect our vulnerable groups, particularly the elderly and immunocompromised groups. These are the two focuses. And as long as the hospitalizations, ICUs and deaths don't rise, there is no need to panic. At the same time, people cannot think that COVID is over. We have to live with COVID. We have to live, and masking is a good health habit. So it has to be voluntary, and we need to encourage people at large to behave responsibly by masking, particularly when they are in close, crowded clusters.
Can I ask you about the voluntary part? And I'm asking you this because I stepped out into a nice Delhi market the other day and saw that most of the people in that shop were unmasked. Okay, and it was indoors, it was crowded. I had my mask on, they didn't. Now, is that smart to allow people to sort of do it on their own, to volunteer to do it? Do we need mask mandates? Do we need to have fines in place to get people to do it in indoor spaces, Dr. Joshi?
See, currently the level of transmission is very low. So if the level of transmission is very low, the likelihood of getting the virus is also low. And most people for the next 3 months till the immunity fades away are reasonably protected. It is only the people who are vulnerable in indoor spaces like we went are likely to have some harm. They may get mild infection, asymptomatic infection. They are unlikely to die.
Yeah, but they might pass it on to someone who's vulnerable, right?
Absolutely, I agree with you there. But I think mandatory is something which I am not so sure. And my personal take is we need to encourage people as a health habit independent of COVID. I think masking in a crowded environment like that as a good health habit, like the way they do in Japan and some other parts of Asia, should be encouraged now, because we have to live with respiratory viruses probably for the next decade.
Yeah, I somehow don't see the Japan example being followed here. But, you know, the other big thing that's happened is the now sudden closure of schools, some schools in the national capital region. And we have Sudha Acharya, principal of the ITL Public School, joining us as well. What is the difficulty, ma'am, that schools are facing at the moment? I saw quotes of teachers, parents earlier today saying that they really don't know what the standard operating procedure is supposed to be if kids test positive. Is there confusion?
There is no confusion. Of course, I can understand the apprehension and confusion among parents. School has its standard operating procedure in place. We are following all COVID protocols and all norms at the entry, at the exit, at school cafeteria. School is getting sanitized thrice a day, right? Early in the morning, during the break time, and after the school. And as reported today in some private school, there was a lot of hue and cry regarding that case. But the school followed all the standard operating procedure, informing parents and the school doctor, staff nurse, taking care of it. We have a quarantine zone also. If you find any child with symptoms, we immediately segregate the child, take appropriate care, inform the parents, and then move away children from that classroom and then sanitize. And as the case appeared today that in some school, 3 children and 2 teachers got affected out of 4,300. So if you can calculate the percentage, it is really very, very less. And school took all. So
do you think that moves to shut down an entire school are just going too far?
I don't think there would be that would be a knee-jerk reaction. We should not panic at all. We are taking care, and as we were saying, that mask, now it has become a lifestyle habit amongst our children. Because as a principal, whenever I take round or at the entry and exit, I don't see any child without the mask inside the classroom. Only when they go out to play or for the yoga session or some outdoor activities, they take it out. That also with lot of precaution. Otherwise, it has become even nursery and pre-primary children also. Now they are coming up with the mask and they tell teachers that always we should be with mask and we take care of ourselves.
I have to
so
say they're quite
orienting all the children.
They're good kids. I just want to get Richa Kapoor here. She's the mother of Tarini Kapoor, who is a grade 12 student. Richa Kapoor, are you, as a parent, are you sort of okay with the SOPs in place? I think only Tarini is with us. Tarini, what's happened in your school? Your classmates test positive?
So my name is Tarini Kapoor and I'm a grade 12 student, and none of my classmates have tested positive. However, with the hue and cry going around, I would just like to say that with everything else open in full swing, closing schools would be cruelty to us as students now, because the impact which the closure of schools has had on our students has been unpacked. There are huge learning gaps. It has affected our mental health. And most importantly, we have forgotten how to socialize.
Absolutely. So you're saying that even if there are cases, don't shut the schools down. Let us learn to live with this, right?
Yes.
Okay. So Pradeep Rawat, you're from the Gurgaon Parents Association. You're the founder of that association. Is that something parents are okay with as well?
See, I have been in touch with almost a lot of parents from all over India, not just Gurgaon, from all over India. And students have been writing to me, especially on Twitter, that what was the exact need of having offline examinations or asking the children to come to the school, especially after 2 years continuous online classes. First of all, they have almost lost the practice of writing, right? In fact, only last week, the DU, the Delhi University students, basically protested for OBE examinations, basically open book examination they wanted, because what happened was, for the first, third and fifth semester, Delhi University hold online examinations, OBE examination, but the second, fourth and sixth semester, they went for the offline mode. Now the students are asking, the parents are asking, what was the exact need of asking a child to wear the mask for almost 3 hours and then give the examination? Similarly, as Madam said, that even the small children are wearing masks, nursery and KG children, but I don't agree with it. I have seen in a lot of buses, none of the children are wearing masks, and when they get down, they are basically literally hugging each other, touching each other. I understand they are, basically want to get in touch with each other. But the fact remains, we are basically too early into the children being sent to the schools. Moreover, the fact remains only the adults of the country are mostly vaccinated.
No,
the
so are you saying you would want
vaccinated.
schools to shut down if there are
No. What I'm saying is there should be more vaccination, plus there should be a kind of a hybrid schooling. The parents who are ready or the children who are vaccinated, they should be sent to schools. But the parents who are not the children who are yet not vaccinated, they could be kept at home or given the hybrid kind of education like online mode. This is what I'm trying to say.
Okay.
Parents should be given a choice. Children should be given a choice. They are yet to be vaccinated. The COVID is not yet gone. We got to be very cautious.
Okay.
Children are yet vulnerable.
Okay,
That is what I'm trying to say.
Okay, you're saying let it be hybrid, and I understand
Yes.
the difficulties of that as well. And there are so many students and parents who really do want schools to stay open. I mean, they've been open after 2 years. We have Dr. Priya Sampath Kumar, who's joining us from New York, who is in fact the chair of infection prevention and control at the Mayo Clinic in Rochester. And Dr. Sampath Kumar, how is it that in the US, in the UK, they managed to keep schools open throughout pretty much throughout the pandemic, and they did it reasonably safely? Is that a model you think India could emulate?
So it was not without controversy in the US either. Parents are divided just like they are in India. Some people want school. Some people, are still nervous about going to school. And most schools are offering this hybrid model. And they've been responsive to local outbreaks. So rather than having a national school policy, it's been left to the local districts to decide. So when cases rise, they move online, and then they come back to in-person learning when locally cases are down. So there are some key differences between India and the US. One is that children here have had the opportunity to get vaccinated. So we are vaccinating children over the age of 5, and there's reasonable uptake in that age group. And the second thing is the school districts, especially in the areas where they can afford to, have invested a lot of money in improving the indoor air quality. So that has been one of the key reasons. And the other thing is they are trying to do some innovative things like pooled saliva testing of all the students. Rather than testing everybody, they're doing pooled testing once a week so they can catch cases early. And then they are using, again, a localized approach. Rather than closing the school, they might close one class down and continue school for the others. So we are struggling with the same kinds of issues, but I think we're a little bit further along in our journey in the US than in India.
Can I ask, though, that is there clarity in the US, because cases are rising in New York and some other states at the moment, about what variant is driving this?
In the US, about more than 85% of our cases are the BA2 variant, which is much more infectious than the Delta variant, a little bit more infectious than BA1, but is tending to cause relatively mild disease in the vaccinated. It's still causing issues in the unvaccinated. But for the most part, since we have a fairly highly vaccinated population, it's not causing the huge increases in hospitalization or death.
Professor Reddy, couple of questions then. One, do you think it's possible for schools in India to stay open? And again, of course, vaccination is a huge problem because not all children are vaccinated, even with one vaccine at the moment. But is it possible? Do you think, hybrid is practical?
I think it's very practical and it's necessary. I don't think we can continue to keep sacrificing education and even socialization of children at the altar of COVID for any longer. Indeed, one message that must be very clear is that while vaccination of children, for perhaps even younger ages than now, may happen and probably will be somewhat beneficial, we must recognize that vaccines do not prevent infection. They only prevent severe illness and death. And therefore, even a vaccinated child can get infected if the child doesn't wear a mask. Therefore, I think the important thing is to emphasize wearing of masks, keeping the classrooms as ventilated as possible, and subject to weather conditions, try and have outdoor activities to the extent possible, and avoid crowded events anywhere. These are some of the precautions that we must continue to take for some time. But closing down schools is not only impractical at this stage, but I think is undesirable. And we must continue to keep our educational activities in flow while taking all the reasonable precautions that we can.
Absolutely. Dr. Joshi, just to come back to the point that you had also made right at the beginning, the importance of genome sequencing. So we know that it's BA2, which is a sort of subvariant of Omicron that's ripping through the US right now. How important is it for us in India to know? And do we really have the wherewithal to know definitively what's driving cases right now?
I think that's a very good question. And in India, our INSACOG and genomic sequencing has been at the top. More than 95% to 99% of the current strain in circulation is BA2 or BA1. We have some sporadic cases or isolated cases of some recombinants. All of them are in the Omicron range, which essentially cause a nose or throat COVID and not a lung COVID or a severe COVID. So clearly the BA2 in the immunocompromised lot or people who have poor immunity can be challenging. I think the genomic sequencing across districts, genomic surveillance, particularly for international travelers coming inbound and for all the positive cases is still the need of the hour. We still have an occasional kappa coming up, an occasional recombinant coming up, but I don't think it is the good thing that it has fully replaced Delta. And Delta was a sinister strain. It was a strain which harmed us and killed people exactly a year back. So it's very, very important to continue genomic surveillance, sentinel surveillance. And remember, COVID is an airborne droplet infection. It's the air circulation which we need to focus on. And we clearly need to ensure that children in general do very well with good, robust immune system, particularly with the thymus they have. So it's very important to recognize that we need to continue both sentinel surveillance and genomic surveillance. And I think India is doing it. And I think we need to also ramp up the test and treat and track strategy, which we had from the beginning.
Absolutely. In fact, one thing I was reading in the newspapers today is how doctors in cities like Delhi are a little concerned that we might be under-reporting cases. People are doing a lot of rapid tests at home now and not necessarily reporting them in. So we might have a lot more cases out there. But as you pointed out, let's not panic. Hospitalizations are important. They're not particularly high. But I can see someone like Tarini wants to go back to school and stay there. Mr. Rawat is a concerned parent who wants the hybrid model. I hope that we can find a way to keep kids in school as much as possible. It's been a very, very difficult couple of years. Thank you very much to all of you for joining us.